Thank you for joining us for this segment of Live Healthy here at Trident Medical Center. Today we're discussing behavioral health with Dr. Yevgeny Gelfand of Low Country Transitions. Thank you for joining us.
Good to be here. Thank you very much.
Starting with behavioral health, what is that exactly?
So under the rubric of behavioral health, we usually mean mental health disorders such as depression, anxiety, bipolar disorder, post-traumatic stress disorder, substance use disorders, and psychotic disorders such as schizophrenia.
And a lot of this depression, anxiety, it affects more people than you realize.
Yes, it does, and it can range from people who feel severely depressed and unable to function to people who have significant anxiety going through their day that is limiting, or people who simply don't feel as good as they would like to feel because of excessive worrying.
What should someone do if they are having those feelings?
Well, first thing is to, of course, talk to somebody like your primary care provider and to see if they can refer you to someone who can be of help, such as a therapist, a counselor, or a psychiatrist if medications might be needed. Sometimes primary care providers may initiate the treatment by starting people on certain medications, and afterwards it is really helpful to refer them to a professional.
And at Trident Medical Center there is a practice called Low Country Transitions. Tell me about that.
So we have an inpatient unit and an outpatient unit as well. On the inpatient unit, we mainly focus on people who are more severely affected, people who have more trouble functioning, going through their daily lives, people who are at risk for harming themselves or have significant symptoms of psychosis, such as hallucinations and delusions, and trouble ascertaining what is real, what is not real, so to speak. On an outpatient setting, sometimes we have people who are somewhat less affected but still significantly and have trouble working, trouble with relationships, still struggle with mood and anxiety, maybe experiencing symptoms of post-traumatic stress disorder, or have trouble using too much substances or drugs as a way of coping, which usually is not very helpful.
Okay. And for our outpatient behavioral health program, Trident Medical Center offers a free consultation. You can call at 843-847-3080 to schedule a free assessment. Thank you, Dr. Gelfand, for joining us today.
My pleasure. Thank you very much for having me.
And thank you for being here as part of Live Healthy from Trident Medical Center.
Live Healthy is sponsored by Trident and Somerville Medical Centers and provided as a service to you and your family.